Hello, everyone. I am Dr. Jennifer M. Jones, and thank you for attending today's presentation on Modules 1 through 7, an overview, things you should know as a prescribing practitioner. This presentation is not to give treatment information, but is meant to raise your awareness as a prescribing practitioner to common or life-threatening concepts to hopefully motivate you towards researching and furthering your education and educating yourselves on the points of discussion. We will begin with Module 5 and not Module 1 because Module 5 will create a foundation for understanding all of the concepts that we will be discussing here today. Before jumping into the meat of things, let's lay the foundation of why we are all here. If it were not for psychotropic medications, we would not have a topic for discussion. We would just have disease states, or we would just be discussing disease as it pertains to mental health. Our goal is to utilize psychotropic medications to decrease disease states associated with psychological dysfunction with the least amount of adverse outcomes as possible. So our first step is to actually define what a psychotropic is. A psychotropic is a drug that affects a person's mental state as well as mood, thoughts, behaviors, or perceptions, and it is prescribed to the patient to help keep them well. Psychotropics work by adjusting levels of brain chemicals or neurotransmitters like dopamine, gamma-aminobutyric acid, GABA, norepinephrine, and serotonin. There are 5 major classes of psychotropics, and they are anti-anxiety agents, antidepressants, antipsychotics, mood stabilizers, and stimulants. And so a more extensive breakdown with medications can be seen in the slides. And so of these categories, some can cause serious side effects and have special monitoring requirements. So it is your responsibility to know how to identify the side effects and monitoring requirements so that you can educate your patients and their families, keeping the patients as safe as possible during the entire treatment process. Psychotropic medications treat mental illness such as anxiety, depression, schizophrenia, bipolar disorder, and sleep disorders. This is not an exhaustive list, so you will want to familiarize yourself with other disorders. Because psychotropic medications act on the body to replace, increase, decrease existing levels of hormones or neurotransmitters, and which are more familiar, it is important for prescribing practitioners to understand that the prescribed medications themselves can cause disorders in the patient. One such disorder is psychotropic-induced endocrine dysfunction. This can be a result of how the psychotropic causes a direct alteration of hormone production, changes in the regulation of the feedback axis on hormonal transport by disrupting binding and signaling, as well as by causing changes that would counter regulatory hormone systems. In addition, the endocrine abnormalities can mimic a variety of other disease states, so it is imperative for prescribing practitioners to recognize drug-induced hormonal and metabolic abnormalities and apply timely interventions. So now we will discuss other challenges that may occur with the administration of psychotropic medications as an overview. And so now we'll go into Module 1. And we'll talk about the blood-brain barrier. In order for some medications to be effective, they must have the capacity to cross over the blood-brain barrier. Drugs that have a greater degree of lipid solubility pass easily across the blood-brain barrier, to include those with molecular weights that are low. The blood-brain barrier is a protective measure that keeps the brain safe from toxins, pathogens, and maintains homeostasis by regulating the transportation of ions, molecules, and cells as they transition between the brain and the blood. Proteins found in the brain promote cell life, which is one reason why it is so important for the blood-brain barrier to provide a protective factor. Important to note is the role of the hypothalamic pituitary adrenal axis, made up of the adrenal glands, the hypothalamus, and the pituitary glands. This is key in maintaining homeostasis and has a role in governing the body's response to stress. So medications that are addictive can engage the hypothalamic pituitary adrenal axis, of which it also makes up a portion of the endocrine system. So it's important to know that as well. If the body gets stuck in the stress response, fight, flight, or freeze, it continues to release cortisol, which is a hormone released in response to stress. Other structure systems shut down when the body gets stuck in the stress response. Some neurotransmitters that you will want to familiarize yourself with are acetylcholine, dopamine, norepinephrine, serotonin, glutamate, and as we mentioned earlier, GABA. Your knowledge about the hormones will aid patients in exiting the stress response and decreasing cortisol by taking the psychotropic medication that you will be prescribing in combination with the life-changing techniques that you will be teaching your patient in navigating their mental illness in a healthy way. And so it's important to note that the psychological disorders can mask medical issues. For example, a patient may be presenting as someone suffering from depression. Depression can manifest as a patient who is apathetic, complaining of feeling tired, having suicidal ideations, presenting with irritability, withdrawal from family and friends, inability to concentrate, and in some cases, the patient may present with hallucinations and delusions absent of psychosis. These signs and symptoms are closely related to the same types of signs and symptoms that a practitioner might see in a patient who is diagnosed with hypothyroidism. In hypothyroidism, mental slowing occurs as a result of disruptions in the thyroid caused by too little thyroid regulating hormone. Too little of it is being produced. Thyroid hormone regulates metabolism in every organ of the body, including the brain. Its depletion affects memory span and the ability to concentrate. Patients have difficulty waking or getting out of bed, feelings of depression, loss of interest in things the patient once experienced as pleasurable also occurs. And this is just an example of among many that may present in your practice. So basically, there are other disease states that may present as mental health problems, and you will want to be able to diagnose that out or understand how to make a clear diagnosis of what is really going on with your patients, whether it's medical or mental. And so we want to move on to Module 2. And so another important topic to be aware of is race and ethnicity in prescribing. Discussing the differences in race and ethnicity as it pertains to how various races receive medical and medication services can be challenging, and it can be a charged topic. So, however, there are some very key differences in how individuals of various ethnic groups physiologically process psychotropic medications. It is important for practitioners to understand the concepts of pharmacogenetics, which is an area of scientific study that investigates the ways in which inherited genetic variability impacts psychotropic metabolism and neurotransmitter receptor sensitivity. This is important to prescribing psychologists because it can aid practitioners in improving the efficacy and prescribing of psychotropic medications to patients. it has been noted that 90% of the differences that are seen in medication responses from patients from a physiological and biological basis regarding toxicity are based on genetic factors. Ethnopsychopharmacology adds another layer of research and application towards being able to provide patients with targeted medications. And so ethnopsychopharmacology focuses on identifying the factors in culture and genetic differences of groups of people who may hail from specific regions and how their physiology and norms play into clinical responses to psychotropic medications. It is important for prescribing psychologists to understand how groups of people metabolize medications based on certain physiological and cultural norms without forgetting the uniqueness of each individual sitting in front of them or sitting in front of you. In understanding these differences, it is also important for practitioners to be aware of how important the cytochrome 450 count is, better known as CYP 450. Now, because serotonin and dopamine are two neurotransmitters that play important roles in several disease states, prescribing practitioners should be very knowledgeable regarding serotonin syndrome and neuroleptic malignant syndrome. So let's begin with serotonin syndrome. It is a condition resulting from having an excess of serotonin in the body, the neurotransmitter serotonin more specifically. There is no other serotonin, but from a medical standpoint. Often as a result of taking selective serotonin reuptake inhibitors, better known as SSRIs, medications that increase the production of serotonin. So these medications that we're prescribing increase the production of serotonin, and that's where the challenge may arise with the patient having serotonin syndrome. So let's go on to neuroleptic malignant syndrome, and it is a result of too little dopamine in the body as a result of taking antipsychotic medications that block the production of dopamine. So serotonin syndrome is not necessarily an immediate threat to health, but neuroleptic malignant syndrome requires immediate interaction with medical services. Because of the excess of serotonin, the brain gets signals to slow down. So this slowing causes the brain to operate in a sluggish way, causing the individual to feel tired and possibly confused. In the case of neuroleptic malignant syndrome, the patient may experience high fever, unstable blood pressure, stupor, muscle rigidity, or autonomic dysfunction. Not to mention the possibility of kidney failure, heart and lung failure, higher than normal levels of acid in the body, and a lack of oxygen in the blood. So you want to be very mindful of that disorder. And so we want to go on to take a look at Module 3. As a prescribing practitioner, you will want to be aware of how gastrointestinal disorders may cause an adverse effect for patients taking psychotropic medications. Gastrointestinal disorders are conditions or diseases that occur within the gastrointestinal tract from the mouth to the anus. So, for example, liver disease. The liver helps to digest food, store energy, remove harmful substances from the body, and fights disease. So when the liver is diseased, it can no longer perform its normal functions. So when prescribing to patients with liver disease, that patient no longer has the capacity to properly process psychotropic medications that primarily pass through the liver before exiting the body. You will want to be concerned with hepatotoxicity, metabolic capacity, and dose adjustments, as well as drug-induced liver injury. Because the liver filters chemicals from the blood and processes the unwanted portions so they can be excreted through the urine and the bile, when there's an excess of toxins from the psychotropic medications, the liver becomes inflamed and damaged, preventing the liver from removing any toxins from the blood. So permanent scarring can occur. A more familiar term for this is cirrhosis of the liver, and this can lead to liver failure or death, hence drug-induced liver injury. And so now let's move on to Module 4 as an overview, and we want to look at how important it is for prescribing practitioners to understand the concept of torsade de pointe, TDP. It is a life-threatening heart rhythm disturbance where the heart's two lower chambers beat faster than and out of sync with the heart's upper chambers. The lower chambers being ventricles and the upper chambers being atria. Tricyclic antidepressants, more specifically than any other psychotic medications, places patients at a greater risk of TDP. Patients with low potassium, low calcium, low magnesium, and patients with liver and kidney disease are at greater risk as well. Medications can affect the sodium, calcium, and potassium channels, causing another condition called prolonged QT intervals. Torsade de pointe is considered an unusual form of tachycardia. When it does not resolve on its own, it leads to a serious heart condition called ventricular fibrillation, which is what leads to cardiac arrest. And when cardiac arrest occurs, this is when the heart suddenly stops. And so TDP can be a complication of long QT syndrome, which is a genetic disorder that is inherited that can be triggered by psychotropic medication. The Q and the T are two of the 5 waves that are tracked on an EKG. The electrical activity in the heart that occurs between the Q and the T waves are called QT intervals. A QT interval is measured from the start of the Q wave through to the end of the T wave. When this interval is abnormally long, the patient is at a higher risk for ventricular tachycardia or TDP. So you will want to be mindful of medications that can trigger TDP and long QT syndrome. And so we have already discussed Module 5 in the beginning, in the overview, in the beginning of the presentation. So we're going to go from Module 4 on to Module 6. And so let's discuss this. As prescribing practitioners, it is very important to be familiar with the data, research, and psychotropic medication recommendations for pregnant and breastfeeding mothers. This understanding should include how psychotropic medications affect the child long term, as well as understanding what it means for the child and the mother if the decision is made for the mother to go untreated. So that means you are taking that mother off of all psychotropic medications. What will happen in that case? You want to be mindful and take note and really consider that before doing it. So prenatal depression and postpartum depression are very widespread, not to mention other mental health disorders that a patient brings with them when they're pregnant. So the exposure of the infant to various psychotropic medications is dependent upon the rate of absorption into maternal circulation, diffusion from maternal circulation to breast milk, and absorption of the medication in the infant. So the breast milk concentration of medication is influenced by lactose, serum albumin, lysosomes, prolactin, calcium, phosphates, and about 30 other minerals and enzymes. So there's a lot going on with a pregnant mother and breastfeeding mother. And so keep in mind that the kidneys of newborns are immature, so psychotropic medications that are eliminated through the kidney may accumulate in the infant, causing toxicity. Also worth remembering is that the blood-brain barrier of the infant is also immature. So lipid-soluble agents can be more concentrated in cerebral spinal fluid than in serum and may be higher in infants for a given plasma concentration. And so it's very important to consider which medications present themselves in breast milk, as breast milk is the primary source of nutrients, immunological defenses, and growth promoting factors for the newborn. Some psychotropic medications in breast milk may cause significant repercussions for the newborn, and some psychotropic medications may cause the mother to want to commit suicide, may cause her to lose the fetus. The child may have future psychological issues, low birth weight, behavioral problems, and possibly cognitive and motor problems. So you want to be mindful of that as well, taking that into consideration. The goal is to know and understand the appropriate psychotropic medications to prescribe for any given patient. It is also important to note that stopping or not giving the mother needed psychotropic medications can also have adverse effects. The mother can relapse, leading to suicide, infanticide, and increased levels of cortisol can build up in the mother and the infant, causing a myriad of challenges for the unborn child through adolescence into adulthood. So we want to take that into consideration. Be proactive and educate patients, creating a pregnancy treatment plan so that barriers and roadblocks can be discussed before they happen. And you want to do that as early as possible. In your studies and research, know which medications in the antidepressant, anxiolytic, antipsychotic, and mood stabilizer classes are safe to prescribe to expectant and breastfeeding mothers, and know which ones are not. And make sure to be confident and aware of other classes of medications as well. And so we are near the end with the Module 7 overview. So let's dive into that. And so we're going to take a look at chronic pain right now as it pertains to our patients. And chronic pain is prevalent. So you will want to make sure to have a working understanding of the role of pain and how psychotropics can be an aid in relieving that pain. Psychotropic medications have been utilized for many years to assist patients with pain cessation. Antidepressants are recommended as first-line treatments for pain. It will be your job to know which antidepressants work best for which specific types of pain. It will also be important for you as prescribing practitioners to know and understand the specific side effects associated with the psychotropic medications excuse me, that you will be prescribing. You will want to educate your patients and aid them in navigating any symptoms that present themselves, side effects to the medication, aid in non-compliance. So a lot of patients will drop out simply because they can't handle or don't want to deal with the side effects of the medication. So it's necessary for you to know how to navigate around and plan ahead for this in order to achieve the most favorable treatment outcomes for your patient. Also, knowing and understanding how a patient's feelings and beliefs play into their interpretation of pain is also very important. And so let's go on to a different topic. Psychotropic medications are also beneficial and play a significant role in helping patients safely get through alcohol withdrawal in a medical setting, though. Excuse me. Alcohol is a depressant, so it slows brain functions, causing the central nervous system to acclimate to its presence in the system, causing the body to function in a higher state in an effort to maintain the capacity for nerves to communicate with the brain. When the patient does not maintain their regular levels of alcohol consumption, excuse me, my apologies, my allergies are starting to kick in. I've been talking under the air, so please excuse me. So when the patient isn't maintaining their normal levels of alcohol consumption and they decide to stop, the body is not able to return back to its normal state. So on its own, and continues to function at a heightened level of functioning without a substance to maintain it. So 12 to 48 hours after a patient stops drinking, they may experience seizures and hallucinations. 48 to 72 hours after, delirium tremens, better known as DT, can take place. And so included with DT, in addition to what has already been mentioned, the patient may be confused, have a racing heart, high blood pressure, fever, and heavy sweating. So medication interventions are necessary at the severe stages of withdrawal. Benzodiazepines and anticonvulsants are utilized in medical settings to aid the patient in withdrawing safely. It is your goal as a prescribing practitioner to be able to safely assess the patient and possibly identify where they are in the withdrawal process and get them to or administer the withdrawal steps appropriately. If you have followed me, more detailed information and references can be found at the information, can be found on the information presentations prior to today's presentation and discussion. So in conclusion, I would like to reiterate that this presentation was meant to provide you with a broad overview of topics and challenges that you might face as a prescribing practitioner. So it is your role to know the intricate details. So take these ideas and learn about them so that you can safely apply them in your daily practice. I am your presenter, Dr. Jennifer M. Jones. Thank you for attending the presentation today on modules 1 through 7, an overview, things you should know as a prescribing practitioner. Everyone be well.